Good afternoon, and thank you for joining us for this weekly update. We continue to do everything in our power to slow the spread of this virus. I want to thank my council, which met earlier today, our city staff, and all our residents and businesses for their support through this crisis. We are working together to face this unprecedented threat. It is becoming increasingly clear over the past few weeks that overcoming COVID-19 will not be a sprint, it will be a marathon. It will take Team Mississauga, Team Ontario, and Team Canada, an effort among all of us to overcome this threat. The individual actions of each and every person in our city have immeasurable impact in our efforts to fight this fight. We have seen our city come together in a way never like before, from organizing grocery and meal deliveries for seniors, to rallying for our healthcare heroes, to donations of PPE and meals for frontline workers. The true spirit of Mississaugans has never been more evident, and as Mayor, this makes me incredibly proud. Today I'm joined by Dr. Lawrence Lowe, our Medical Officer of Health at the Region of Peel, Tim Beckett, our Fire Chief and Manager of our Emergency Operations Centre, Chris Varco, President of the Mississauga Firefighters Association, and Megan Nichols, Executive Director of the Mississauga Food Bank. I'd like to provide you with an update on what we have been up to since last week's update, and then invite Dr. Lowe up to brief us on Peel Public Health's efforts. Right now in Mississauga, we have 622 cases, which represents nearly a 9% increase over yesterday. And while I know we have not yet hit the peak of the crisis, I'm heartened by the single-digit increases we've now been seeing for 6 straight days in a row and in 7 of the last 8 days. It's proof that our efforts are making a difference. Your actions of 2 weeks ago are having an immeasurable impact today, so please, let's keep it up. We do, however, continue to see people disrespecting closures in our parks, not keeping a safe distance, or bending the rules when it comes to gatherings with families and friends. Which is why over the Easter weekend, we launched our second blitz across our parks and public spaces, because unfortunately, many are still not getting the message. It will not be tolerated, and we will make an example of them. Education is always our preferred option, but when faced with blatant disregard of the rules, we are left with no other choice but to issue tickets. Since we've stepped up our efforts, we've stopped over 8,500 people to educate them on the rules, and turned back over 3,000 cars at our parks and issued 25 tickets ranging from $365 for a bylaw infraction, that was trespassing, to $750 plus for violating the city's and the province's emergency COVID-19 order. Last weekend alone, we had 30 officers out blitzing hotspots across the city. Officers stopped and educated nearly 2,600 people and turned away 1,600 cars from entering our parks. We issued 8 tickets, from trespassing to playing golf on a closed golf closure, to hopping a tennis court fence to play cricket, discarding used PPE in a grocery store parking lot, using our playgrounds and our tennis courts, and even bringing dogs to off-leash parks to run around while they were closed. And last but not least, a balloon and party store with its doors still open to the public, being a non-essential business. I'm frankly tired of hearing about all these incidents. It's one thing if these individuals weren't aware of the rules, but they are. And often they make a point of telling our bylaw officers they're simply choosing to ignore them. Their poor choices are putting their health and the health of their family and friends and countless others on the line. Know that we will continue to have boots on the ground to enforce the rules. So please, don't risk it. We have 157 bylaw officers to enforce the emergency orders. We are doing our part to keep you safe. Please, do yours by staying home and respecting the rules when you are out. Today, our council met virtually, and we decided on additional measures that will help our city cope financially with COVID-19 and provide some relief for residents. Today, we, number one, announced a temporary hiring freeze at the city until further notice, unless required for essential workers. During last week's update, I outlined some of the short and long-term financial challenges we are facing. The impact of COVID-19, currently running at $43 million, and that would balloon to $59 million by the end of June. Like all Canadian municipalities, Mississauga's deficit could top $100 million by the end of the year, depending on how long distancing measures are in place and people cooperate. Cities are not legally allowed to run deficits, unlike higher orders of government. We need support from the province and the federal government. We've already made some tough decisions, including temporarily laying off 2,000 part-time staff who worked in our community centres, our libraries, our cultural facilities that are now unfortunately closed. And today we announced a temporary hiring freeze on all new recruitment to the city until further notice. Combined with our temporary staff layoffs, this is expected to help us identify $2.3 million in savings by the end of June and $8.2 million by the end of April and $8.2 by the end of June. Secondly, we deferred renewal fees for pet licensing and mobile licenses until June 1st. This was done to alleviate the burden on pet owners, many of whom are struggling right now to make ends meet. It also recognizes the impact that COVID-19 has had on travel patterns, and especially on our taxi industry. Thirdly, we're working to close lanes of traffic so that they can be used by pedestrians and cyclists instead. Our goal is to ensure we're creating the right conditions for physical distancing while allowing people to get fresh air and exercise. We will roll these out in the days to come in consultation with the local councillor. Fourth, we continue to meet groups right across our community. Yesterday, we met virtually with 70 social service agencies who are serving to provide our most vulnerable with the assistance that they need. We've consulted with over 400 groups from across our city, which represent thousands of residents. From our business community, our tourism sector, seniors groups, resident associations, and later this week, our faith leaders, to better understand how COVID-19 is impacting our community and them, and to formulate a plan of action for the recovery. These consultations are on top of the almost 50,000 people that we've connected with through our 2 tele-town hall meetings. Fifthly, today we're also launching a dedicated web page for seniors so that they can get information on everything from where to access food deliveries to how to keep fit during the pandemic. It will be located on our coronavirus website at mississauga.ca/coronavirus. This was requested by many seniors groups in our community following our consultations. Before I hand it over to Dr. Lowe, I want to take the opportunity to also provide you with a brief update on some of our regional initiatives. Starting next week, every household will be allowed 2 extra bags of garbage on collection day without needing bag tags. We know people are spending time at home and generating more waste, so we need to be mindful of that. However, I do ask that you resist the urge to purge. Please do your part to keep our workers safe and our community clean. We're also working to ensure our essential workers have access to safe and reliable childcare. I'm pleased that we now have 5 daycares in Mississauga that are open for essential workers and that have a capacity to support roughly 94 children. The majority of these are operating in our local YMCAs. Today, I also sent a letter to the Minister of Government and Consumer Services, Lisa Thompson, asking the government to take action to address the predatory practices of payday lenders who have been taking advantage of the most vulnerable during this crisis. We are hearing reports that they are charging up to 390% in annual interest, and this is simply unacceptable. I'm asking for the province to review the lending criteria, specifically lowering the level of interest and altering the terms to make them easier to pay back. With increasing numbers of people turning to payday lenders at this time, I worry that far too many people will find themselves in severe debt after this crisis, and that will itself prove to be irreversible. Last but not least, I'd be remiss if I didn't address the growing number of COVID cases in our long-term care homes, a subject I know that Dr. Lowe will also address. Mississauga is not immune to this growing crisis. As you've heard from Dr. Tam, half of all COVID-19 deaths in Canada are in our long-term care homes or our senior centres. That, of course, is someone's mother, father, grandmother, or grandfather. It's always inevitably, incredibly tragic and sad when anyone in our community contracts COVID-19, particularly our seniors, who are among the most vulnerable in our community. Here in Mississauga, there are currently 10 homes across the city with cases. These are the very people that we are fighting for by staying at home. I send my condolences to the families who have lost a loved one and give my strength to all of those who are still fighting. I want to thank all the doctors and nurses and personal support workers in our long-term care facilities for their courage and their bravery. I know this can't be easy. And now I'll turn it over to our Chief Medical Officer of Health, Dr. Lawrence Lowe, to provide us with a brief update on Peel Region's response to the virus. Dr. Lowe?
Thank you, Madam Mayor, and good afternoon. I'm pleased to be able to provide an update on the ongoing pandemic of COVID-19 and how it is unfolding in the region of Peel. As of this morning, there are 1,156 confirmed cases of COVID-19 in the region of Peel. 622 of those are residents of Mississauga. Elsewhere in the region, 482 are residents of Brampton, 45 are residents of Caledon, and 7 are pending further information. Amongst the 1,156 confirmed cases of COVID-19 that have been detected in our region, 282 of those are in individuals over the age of 65, 642 of those are in people between the ages of 35 to 64, 210 are between the ages of 18 and 34, and 22 have been detected in individuals under the age of 18. We have also regrettably had a number of deaths. 25 people have succumbed to COVID-19. 22 of those who are individuals over the age of 65, and 3 who are within the ages of 35 to 64. I will state at the outset that as our case numbers continue to track, I am starting to see glimmers of hope that physical distancing has done well in actually helping to make a difference and slow the spread of COVID-19 in our community. Certainly, we at Peel Public Health are continuing to track the numbers on a daily and hourly basis to ensure and confirm that this trend is occurring, but it is also a reminder that we must continue to keep up the physical distancing in order to ensure that we are limiting the transmission of this disease in our community. As we decrease our interactions, we decrease the spread of COVID-19 and slow its propagation in our community. I did want to speak, however, about where the battle is shifting to in our region as well as across the country, and that is our long-term care homes. Of the 25 passings that we have had in the region, 6 of those were residents of long-term care facilities. We also have over a dozen long-term care homes that are currently in outbreak, and we at Peel Public Health, together with many across the province, define an outbreak as one case of COVID-19 in a staff or in a resident of the facility, and that should demonstrate just how seriously we are taking this issue. As the Mayor correctly pointed out, these are parents and grandparents and members of our community, and they have been a priority since the very beginning of our COVID-19 response and continue to be a priority in the immediate moment. I have been on constant calls and conversations with our colleagues at the Ontario Health Central Region, our hospital partners, and also with long-term care homes throughout the region, both our regionally owned ones at the region of Peel, as well as those within the wider region, to really understand how we can start to support our long-term care homes in a number of areas. Firstly, around staffing. Secondly, around testing and preventing outbreaks and controlling outbreaks. Thirdly, around communications. Fourthly, around personal protective equipment. And fifthly, around virtual care, and essentially making sure that these residents are still getting the care that they need. All of us, from Ontario Health to our hospital partners, to our paramedic services, to every single component in the healthcare chain here in the region of Peel, is now redirecting our focus and attention fully to addressing the long-term care home outbreaks that we are seeing here. That said, Peel Public Health is also continuing the other critical services that we have provided through the COVID-19 outbreak. We continue to be available through our call center at 905-799-7700, 7 days a week from 8:30 a.m. till 10 p.m. We continue to update information on our website at peelregion.ca/coronavirus and also on our social media handle through the @RegionofPeel Twitter. We also continue to work and coordinate with various other partners to ensure that the messaging around physical distancing is getting out there. But I want to be clear, we must not let up. Physical distancing is certainly making a difference in the community, but it is also helping to protect and make our jobs easier in stemming the flow of outbreaks and cases arising in long-term care homes. The more that we can stay at home, self-isolate if we're not feeling well or if we've returned back from outside of Canada, and also just really emerging just for essentials. And I'll be absolutely clear, for those who are sick and for those who are returning from Canada, self-isolation means staying home, in your home, for 14 days and relying on other people for essential services. For everyone else, to the extent that you can limit your interactions in the community to essential services such as groceries, prescriptions, seeking medical care, or exercise on your own with a partner or with a pet, you will continue to keep the front that we have in the community strong so that we can continue to address the urgent need that is arising in our long-term care homes and retirement homes. Stay well and stay home and stay safe, both for yourself and for those who are unable to, for those in our community who are certainly more vulnerable and unable to do so. So thank you very much, and I'll pass it back to the Mayor.
Thank you, Dr. Lowe. I want to end today's press conference on a positive and very uplifting note. At last week's press conference, we launched the Mississauga Challenge in support of our local food banks alongside of Paramount Fine Foods CEO Mohamed Faki. For some, this COVID pandemic is an inconvenience. For others, it is certainly a personal crisis. Thousands of people across the city are out of jobs and relying on food banks today more than ever. We announced a lofty goal to raise $840,000 to keep the shelves stocked during this crisis. And a little over a week, we have made tremendous progress and have raised roughly 50% of our campaign goal. I just received word yesterday that Electra Utilities has generously donated $50,000 to the cause. That's in addition to the support programs they are offering to low-income residents and also waiving late payment charges for 60 days. There have been several other significant donations made to the food bank this week, and now I'd like to turn it over to Megan Nichols to provide us with a quick update. Megan?
Thank you, Mayor Crombie. I'd like to start off by thanking Mayor Crombie and Mohamed Faki from Paramount Fine Foods for stepping up and leading our community in generosity during this time of need. A week ago today, the Mayor and Mohamed launched the campaign, the Mississauga Challenge, with the goal of raising $840,000 to support the urgent need we're seeing here in the community. And the response in just 1 week has been absolutely incredible. In really groundbreaking time, to be able to achieve 59% of our fundraising goal already is going to enable us to provide nutritious meals to our hungry neighbors now and in the next months. So as of today, our community has raised a total of $498,000 already. So I'd like to say a special thank you to the following individuals and organizations who have made significant contributions to this campaign. To the Peter Gilligan Foundation, to the Mississauga Firefighters Association Benevolent Fund, Electra, as Mayor Crombie mentioned, Fo Guangsheng and Buddha's Light International Association, VentureX Canada, Unifor National, Jame Masjid Mississauga, Pervez Actor, Nav Bhatia, the Superfan, Chicago Title Insurance Company, FNF Canada, and Gilmore. As we navigate this unprecedented time, the Mississauga Food Bank needs your continued support to ensure that we can help families across the city. The money that has been raised already through this campaign is already at work, supporting the urgent needs of vulnerable community members during the crisis today and as it continues in the weeks to come. Well, we're over halfway there. Together, we will still need to raise $342,000 to get us through this critical period. It really does take all of us to feed our hungry neighbors during times like these. And alongside this challenge, the Mississauga Food Bank is working with various community groups, individuals, and the government to ensure funding is available so that our service can remain sustainable, as the economic impact of this pandemic will be felt for months to come. While we may all be social distancing, as we've been asked to do, the community has come together closer than ever as we rally to feed our hungry neighbors. I'd like to pass things over to Chris Varco, President of the Mississauga Association of Firefighters.
Good afternoon. On behalf of the men and women of IAFF Local 1212, the Mississauga Firefighters Association, and the Mississauga Firefighters Benevolent Fund, I'm pleased to announce that we are donating $100,000 to the Mississauga Food Bank. This was a decision that was easy for the Benevolent Fund and the Board of Trustees, who work tirelessly year-round to raise funds and make donations into the community. This was an easy decision for them. They quickly came together to see what they could do to help those in need during this crisis, and I'm very pleased to be part of that team. I'm just the person that gets to make the announcement today, but it's the hard work of the Benevolent Committee that's made this possible. We're very pleased to be able to step up, and while firefighters are on the front lines, not only in Ontario and across Canada and the continent and around the world for that matter, we're also working where possible to provide assistance in a charitable sense to be part of the community and to be teammates in this crisis. We're all in it together. Thank you very much.
Very moved that even our frontline heroes are feeding our hungry. Thank you to Chris Varco and, of course, the Mississauga Benevolent Firefighters Association for their very generous donation. Our city's 700-plus firefighters, we all come together and we all thank you. Our firefighters are not only working on the front lines, but behind the scenes to keep our city safe and ensure that no one is left behind. Before I close, I want to take a moment and thank all of our healthcare workers, those in our hospitals, in our long-term care homes, our COVID assessment centers, our paramedics, our police, our firefighters, and of course our essential workers, including our transit drivers, our bus drivers, the grocery store workers, the pharmacy workers, the transport truck drivers, and so many more. Thank you to everyone. When we asked you to stay home as much as possible, it's not only for your health, it's to keep them safe so that they continue to care for your loved ones and keep our city running. We still have not seen the peak, so please buckle down. Stay strong. Keep your spirits high, and we will get through this together. Lives are at stake here. And now I'll open the floor to any questions you may have. Thank you.
Mayor Crombie, your first question comes from Steve Cornwell from the Mississauga News. Steve, please go ahead.
Welcome, Steve.
Hi, Mayor Crombie. How are you? Just asking first about, you mentioned the payday lenders and people potentially taking on high serious debts through this pandemic. As it stands now, Council has moved to defer property tax payments until July. My question is, what does the city have any measures in place, or is it anticipating what would happen if folks are not in a better position to pay their taxes come July?
Yeah, so April taxes referred to July, May till August, and June till September. So certainly this is a situation we continue to monitor very closely and reevaluate. The Premier has announced that even schools will not go back, will not return till after potentially May 4th. So because our council continues to meet virtually each and every week, it allows us to monitor the situation. And should we need to, I know that we will do the right thing and make further adjustments and deferrals.
Just to follow up on that, you mentioned last week when asked about kind of what would happen if the province and federal government don't necessarily come through with the aid the city needs to tackle its deficit. What can residents expect to see if that happens? Like, are we talking about service level reductions, higher taxes? Like, what's on the table?
So, Steve, is an excellent question and one our council hasn't begun to discuss yet. However, there are a lot of options. I will say that Mississauga is a very fiscally responsible city, very well-run city. We have very healthy reserves, and I think we'll have to take a very close look, do a line-by-line examination, and see what programs, capital projects could be delayed, deferred, cancelled. We will look at service levels, and we will look at our reserves, and we will continue to look at other levels of government as well. So, you know, this is a discussion that still has to be had, but as I said, if this continues to the end of June, we will be in a $59 million deficit by the end of June, and if it goes any longer towards the end of the year, it could be a deficit as large as $100 million in Mississauga.
Mayor Crombie, your next question comes from Isaac Callan from The Pointer. Isaac, please go ahead.
Hi, Mayor Crombie.
Welcome, Isaac.
Thank you. My first question is about fines. This morning's discussion at council, I think, highlighted that even among some of your councillors, there's some confusion about what is allowed and what's not allowed. And I know the city's been educating people with more than 8,000 education stops, but is there not a more efficient way to disseminate this information, a social media campaign? Are you looking at changing the approach to highlighting what people should be doing and what they can't do in parks?
I think the easy answer is we've been trying to do our best, Isaac, to inform all the councillors have, and I have, as on my daily video updates. Dr. Lawrence Lowe has. I think you will see every mayor of every municipality, as well as the premier, sending those messages that is unsafe for people, 5 unrelated people to gather, and I will venture to say I think it's unsafe for 2 unrelated people to gather at any one time, and that people should always respect physical distancing of 6 feet or 2 meters, and I think that is the simplest way to look at it. I do have a little highlight cheat sheet for you, Isaac, and I'm happy to share this with you, but there have been many public complaints that our bylaw officers have investigated. Certainly there have been over 1,050 in fact, since we began enforcement, and even in the past 24 hours there have been 56. We have issued 10 fines in the past 24 hours and 25 cumulative, and they include, these are all but 8 are $750 fines. The other 8 are $365 fines, which is a parks bylaw and a PPE littering bylaw fine.
Thank you. In that case, then, if the message has been spread as clearly as it can, when will you move to more of a zero tolerance and move away from education towards complete enforcement?
I think our bylaw officers always take the opportunity to educate first, and often we find that we're just not thinking in the moment, saying, oh, geez, of course we shouldn't be doing this, and move away. But there are 4 notices of contravention of a non-essential business being open. Of 3 of them willingly complied and closed their doors. The 4th one was not willing to, so they did receive the bylaw infraction of $750. So we are very vigilant, Isaac. However, we use the opportunity to educate, and sometimes there are momentary lapses.
Mayor Crombie, your next question comes from Jay Canna from Modern Mississauga, and I'm going to ask his question. Are you open to answering children's questions from Mississauga about COVID-19, similarly to what Prime Minister Trudeau recently did? If yes, please let me know how Modern Mississauga media can help move this forward.
That's a great question, Jay, and I did notice that you were tweeting our press conference, and we thank you, and I would be more than delighted. I'd be honored to answer the children's questions, and we can get that done as soon as possible. We can get that set up. If you want to contact Nicole McInerney in my office, my Director of Communications, I'm sure she can set that up. Thank you.
Mayor Crombie, your next question comes from Ashley Newport at Mississauga. Ashley, please go ahead and ask your question.
Mayor Crombie.
Welcome, Ashley.
So my question is, I know that opening up the economy is a long way off. Today we were told it would at least be several more weeks, and we know the province has extended its emergency orders into May. But I was wondering, I know Toronto has kind of its own, it's talked about, not in too much detail, about its own kind of city-specific Made in Toronto plan to eventually gradually reopen the economy when the time is right. I'm wondering if Mississauga has or is talking about doing the same thing, kind of a Made in Mississauga approach to gradually reopen the city when it's safe to do so?
Excellent question, Ashley, and I thank you. We have had a meeting with our Economic Development Advisory Council twice now, and we've included all the BIAs representing all the business communities in our city, the 4 of them, Clarkson, Port Credit, Cooksville, Malton, and Streetsville, 5 of them, sorry, throughout the city, including some other businesses and stakeholders in some key sectors. And I will share with you that the advice was primarily focused on the recovery and what we will do, what kind of campaign we could launch in Mississauga to ensure that everyone knows that we're once again open for business, and how can we spur on local activity so we can get the economy kick-started and moving once again as soon as we have crossed the path, over to the other side of the peak of the crisis. So we have been continuing to meet with different groups and organizations, as I said in my remarks, our Economic Development Advisory Committee, our Tourism Sector Advisory Committee, the social service organizations that I mentioned, seniors groups. We had over 50 seniors groups on a call. Yesterday we had over 90 service organizations on the call, and we'll have interfaith leaders on the call Thursday and Friday. And all of these groups, we focus on how they've been impacted by COVID-19, what more the city can do, and how can we help them in terms of recovery to get back on their feet. What more will the city do once once we're over the other side?
Okay, and just a really quick follow-up. Would the city be open to considering any kind of special reopening gathering or celebration when the time is right, or is it still kind of difficult to say whether or not any big gatherings will be able to be permitted for the foreseeable future?
You know, I would love nothing more than the city to come together and celebrate, but Ashley, I don't see that in the foreseeable future. Even Canada Day, we will mark it differently this year, whether it's virtually or we'll postpone the date. I don't know what we'll do to mark Canada Day, but there will be a time where we will all come together and celebrate, but it won't be in the foreseeable future. I think it will continue to be unsafe to bring groups of 20,000 or more together, and I'm looking at Dr. Lawrence Lowe, and he is nodding at me. So we do look forward to that time, Ashley. I look forward to giving someone more than just a virtual hug, too.
The next 2 questions are for Dr. Lowe.
Okay, perfect. Thank you.
Hi there. Go ahead with the questions.
Hi, Dr. Lowe. Your first question is from Sabrina Gamrot from the Mississauga News. Sabrina, please go ahead.
Hi, Dr. Lowe.
Hi, Sabrina.
Hi. So my question is, if the residents of Mississauga continue to social distance and follow the guidelines that have been put in place for the past couple of weeks, when can residents expect to see the peak of this pandemic?
You know, it's a great question, Sabrina, and so you'll have to remember that the way we actually track this virus is that it has an incubation period of 2 weeks. So meaning from the time you might be infected, it can be up to 2 weeks until you actually show symptoms. And then subsequent to that, once you actually develop the symptoms, it can be up to a 2-week course for most mild disease that doesn't require hospital treatment. And so the idea is that what you'll be seeing in terms of new cases reflects what we were doing approximately 2 weeks ago. And what you might be seeing in terms of what is presenting in clinics or in hospitals and in our intensive care units is essentially reflecting what we were doing a month ago. So if you'll remember, about a month ago, we were just starting March break, essentially. And 2 weeks ago, we were just finishing up, and I believe many people had returned from March break, and we were just in the midst of getting into the next phase of the provincial emergency. So the reason I have certain glimmers of hope is that we are starting to see our case rise slow day by day, which suggests that physical distancing is working and also suggests that we must keep it up if we don't want to see something rise again 2 weeks from now. But in terms of where we see things going, I think we're following essentially 2 different peaks, right? You're following the case, and then you're also following what's happening in your hospitals and your ICUs to make sure that they are coping with the increased demand. And we have started to see increasing severity in our hospital settings and also in our long-term care settings, which suggests that we are certainly not out of the woods yet. Hopefully, hopefully if it takes some time, it'll be about 2 to 4 weeks after the course of seeing the cases plateau. So I know that was a really long, complicated answer, but all that to say, it's still going to be at least a few months yet, and especially if we want to see some sort of peak or plateau, we'll have to keep up physical distancing, at least for the moment, to get this under control.
Okay, thank you. So then my next follow-up question would be, so today I believe we saw 93 newly confirmed cases for the region, and that's, I think, maybe, if not the highest, probably the second highest single-day increase. Is that sort of a good sign to show that maybe we're sort of getting through the harsh parts?
Yeah, so I've said this throughout many of sort of the communications I've issued. The previous week and this week are the ones that are likely going to reflect again what was happening 2 weeks ago. So people coming back from March break, people who maybe had sort of just gotten into the idea of physical distancing, but maybe not necessarily had started taking part fully. So you would expect to see significant rises in cases, at least throughout the end of this week. And I'm really hoping, and this is where my glimmers of hope comment comes in, I'm hoping that our picture next week will help to reinforce why we must continue to physically distance in order to essentially try to level and control the spread. So this week will continue to look certainly concerning, but I want to emphasize that any rise in cases like the one that you've just mentioned for today is certainly expected.
Dr. Lowe, your next question is from Louise Hernandez from Presencia Latina. I'm going to ask her question for her. China is in the last phase of COVID-19, and European countries are seeing a decline. How is Canada, Ontario, and Peel doing in comparison?
Thank you very much for the question, Louise. At this time, as I mentioned, we are still very much in the early phases of the pandemic. We are starting to sort of go through the phase where there is an increase in rise and spread in the community, but making sure that we've actually put in physical distancing to actually slow that. So to a large extent, we are still early days here as compared to Canada and other jurisdictions, but I'm hopeful that we will be able to move on in the coming months to more targeted measures, if we are successful at controlling it in this phase. So thank you for the question.
Second question, Dr. Lowe, is has the number of people affected been estimated or has it exceeded expectations?
Not quite sure what is meant by estimated or exceeded expectations. In terms of what we are seeing with the confirmed cases that are rising right now, that is certainly expected, as I mentioned in my previous answer, just based on what we were doing 2 weeks ago. But in terms of estimations, we do know that the confirmed cases are not all the cases in our region. We know that our confirmed cases give us a snapshot or an approximation as to how this is spreading throughout the region of Peel. And so it is for that reason that we really do emphasize the importance for people who may seem well, who are well, to still stay home as much as possible so that they're not inadvertently spreading this disease in the event that they are brewing an infection. We do have good evidence, for example, that the disease can spread pre-symptomatically, for people 1 to 2 days before they develop symptoms, and certainly anyone who is sick should absolutely be staying home and helping us to slow spread as well.
Thank you, Dr. Lowe. The final question is for Mayor Crombie. Mayor Crombie, could you please come back up to the podium?
Thank you, Nicole.
Mayor Crombie, your last question is from Louise Hernandez from Presencia Latina. She'd like to know what your biggest challenge has been in terms of managing this crisis, and how do you assure your residents that everything is going to be okay?
Thank you, Louise. That's a great question, actually. But first, let me say that there have been so many glimmers of hope. This is being the 6th day of single-digit increases gives me some cautious optimism, and that's been 7 of the past 8 days that we have seen single-digit increases. And I think I read in the province of Saskatchewan that they had only 1 new case. So there are locations across Canada that are seeing a real difference in that their measures have made. The public, having followed closely the guidance of public health officials, has made a real difference. And I think the challenge was getting that message across. The importance of separation, the importance of physical distancing, the importance of staying 6 meters apart or 2 meters, and the importance of staying home, and how people saw that some essential workers were at work and others had to work from home, and that the message of just staying home home, not inviting friends over for coffee, for tea, for, a play date for your children. I think that was a very difficult message to absorb. Go home, stay home, work from home, catch up on your correspondence, read books, watch Netflix, purge your cupboard. Those were very difficult messages to send out, particularly to our seniors who we're deeply concerned about, particularly anyone over 70. We wanted them to stay home and not even make that trip out for essentials, for food or for groceries or for medications, have their support networks, their family or loved ones drop those off to their door, and then of course once they put them all away, to disinfect, sanitize and wash their hands. The message of hand washing to our youth, I know, was a difficult one. I know that our youth aren't used to washing their hands after they're out and touching things, and that was a difficult message. But the message to ask people just to go home and stay home, work from home, and to practice that physical distancing and not gather in groups and not gather with their friends and not have their extended families over for evening dinners or particularly religious holidays. We just had Passover, we had the Easter weekend, and Ramadan is still to come. And these are very important times for extended families, and to get that message to them that it was so vitally important that they celebrate with only the people that they've been isolating with in their households that week was critically important to the health and well-being of all Mississaugans, all Canadians for that matter, and particularly that we were concerned about those with compromised immune systems, women who are pregnant, but vitally important to our seniors and the elderly in our community. Thank you, Louise.
Thank you, Mayor Crombie. There are no further questions. This concludes today's press conference. On behalf of Mayor Crombie, I want to thank everyone for participating. We will keep you updated on future press opportunities, and our media team will be sharing a link to the video of this press conference with you shortly. Have a great day and stay well.
Thank you, everyone.